So before I ask you about today's publication, can you just give us a quick recap on the series?
So the Prime Minister's vision for a smarter state rests on the idea that we can use the latest digital technology to deliver better public services. Now, there are some great examples of where that is taking place, but at the moment, reform has been a bit patchy. So this series of papers that we're conducting with Accenture is looking at 4 discrete examples like virtual courts and police reform that we've already looked at to examine how technology is transforming the public service, the public sector, and what lessons can be learned more generally.
And so, what is the publication you're putting out today? What's that topic?
So today we're publishing the future of public services, digital patients. Now the use of digital products has exploded in the last 2 years. UK consumers are using apps at twice the rate that they were. For wearables, usage has tripled. Now the benefits that this could bring are very real and tangible. We know that there is a strong link between health literacy and, for example, poorer health and increased hospital admissions. So for policymakers, the opportunity to use these products is that we could engage people in their health and thereby drive better outcomes for the NHS.
So this idea, I guess, of using technology and driving self-care by patients or better patient-clinician relationships is something obviously that has been around for quite a while now. As you say, people in their private lives have very much embraced the kind of wearable tech and that side of things. Why has the NHS not realised the benefits already of digital technology?
So the crux of the problem at the moment is that although consumers are increasingly adopting these products and they're willing to share this data with their care teams, they aren't yet at scale. Now, the absence of infrastructure may have been a problem in the past, but now patients have access to their electronic health records. So this could enable patients with the consent of their GPs to start uploading this data onto their electronic health records. Now, the benefits of this would be quite clear, and particularly for those with chronic health conditions, because it would allow care teams and consumers to have a much richer conversation about how to manage their symptoms and indeed what triggers their symptoms. And we spoke to Beverly Bryant, who was the digital technology lead at the NHS, and she said that this new mechanism might become the de facto way for patients to interact with the NHS in the very near future.
So what are the key challenges then to making that happen, and what in this report is your message to government, the health service, the broader public service community to actually realise these benefits?
So we identified 2 quite clear challenges that the NHS will have to overcome in order to deliver the vision that Beverly Bryant has spoken of. The first is that the NHS will need to secure the buy-in of the clinical community. We know this is incredibly important. In Australia, for example, and a similar electronic health record program saw disappointing uptake, in part because policymakers did not fully consult with clinicians and take on board their feedback. A second problem is that the mobile health market is incredibly complex and growing, and this poses a challenge for consumers and clinicians who want to try and find the best products to use. Now, the traditional approach that the NHS has adopted has been one of command and control, and they're now rolling out a new endorsement model where products that pass through a certain process will be NHS kite marked. But we suggest in the paper that because of the dynamic nature of the mobile health market, it might be an idea to adopt a peer review technique. This is one which has obviously been pioneered by TripAdvisor, but it's increasingly being applied in academia. And for example, the Faculty of 1000 group is using this peer review mechanism for publishers who want to post papers on biomedical research.
Thank you.